Hi, everybody. My name's Susie Turnbull, and I'm the former chair of JCPA and JWI and a current member of the JCPA Executive Board. Thank you for being with us. I'm grateful for the technology that allows us to connect to each other, and I'm sure that during these times, we're looking forward to being with our loved ones and friends in 3D at some time soon. But until then, for those of you who aren't familiar with us, JCPA is the network hub of 125 Jewish community relations councils and 17 national Jewish organizations. We educate, advocate, and mobilize on issues of concern to the Jewish community. We're proud that this network includes 5 prominent national women's organizations. We also have a robust policy platform of our own and advocate on issues across the spectrum. We believe that women's issues are all of our issues, whether they be social justice issues, economic issues, or issues about education, equity, or reproductive rights. JCPA has an active agenda and is especially concerned about the recent rollback of policies that impact women. We're an advocate for the reauthorization of the Violence Against Women Act and recently issued a statement about the restrictions on women's reproductive health and rights at the state level. During the pandemic, JCPA has been advocating with its coalition partners to ensure the CARES Act and other policies support women who make up the majority of frontline workers and people who have lost their jobs. We also supported sign-on letters concerned about women who are the victims of domestic violence being in social isolation with their abusers. We will continue to work to fight the war on women and help the most vulnerable and risk even after the COVID-19 has come under control. In our emerging reality, we're faced with new challenges and new wrinkles on old challenges. But if there's one overarching observation, it's that people who were vulnerable before the pandemic are even more vulnerable now. They require greater protection and support. While we've seen quite a bit of racial and socioeconomic equities, what hasn't gotten the same attention really is the overwhelming effect of this pandemic on women and families. To discuss this issue, to discuss how women are being overwhelmingly affected in the pandemic, we're honored to have with us 2 of my dear friends. They are 2 dynamic CEOs who each in their own right has had tremendous experience over time. We couldn't have 2 more effective advocates and thinkers to help us make sense of the current moment and how we advocate for women. Both Meredith and Sheila are change makers. Meredith Jacobs is the CEO of Jewish Women International, which empowers and ensures and protects the physical safety and economic security, promoting women over years and years. The storied organization originally began as B'nai B'rith Women, but over the years, it has developed into being a leader with young women and as well as our women who have been longtime members of the original organization. JWI inspires civic participation, and Meredith herself has had a tremendous background. She's an editor, she is an author, she is a mom, she is a leader, and since January, she has been CEO of JWI. Sheila is the CEO of the National Council of Jewish Women, a grassroots organization of 100,000 advocates who are living out their progressive Jewish values for advocating for women, children, and families in the United States and Israel. I first met Sheila several years ago during her time at Hillel, where she was a great thinker and helped people answer the big questions before us and worked to be a leader for young people and young women across this country. When she was chosen CEO of National Council for Jewish Women, it was after a national search that interviewed many, many people, and they picked the right person last year when Sheila Katz took over as CEO of the National Council of Jewish Women. So we're going to get started. And what I want to make sure people understand is that we will have information, question and answer time after each of our speakers has a chance to give you some strong background on what's going on. But we will also list things for action, for things for you to do after the seminar. But I want to make sure that you understand that JCPA is putting on lots of these webinars, and we hope that you'll participate in all of them, or the ones that are most interesting to you in the near future. And I would also ask that you consider that these are challenging times for all these nonprofits organizations, just like JCPA, JWI, and NCJW. And it would be a good time to provide some financial support to these organizations and other organizations you care about so that they can continue to function effectively and be your advocates for the people who need the help the most. So let's begin, and let's hear from Meredith.
Thank you, Susie. I've known Susie for years, and I'm proud that she is a former board chair of JWI. And thank you to JCPA. As Susie mentioned, the issues we're discussing today are not new. They weren't caused by COVID-19. But what has happened as a result of the pandemic is that the very few safety nets that were in place have unwoven. That said, whatever curtains were drawn to hide these issues are now opened. When we are hearing that women who, because of stay-at-home orders, are now forced to quarantine with their abusers, we listen. JWI and NCJW both work on behalf of all women and girls, but Sheila and I have divided up what we're each talking about today based on the specific core issue areas of our organizations. And I want to begin by thanking my programming and advocacy team who are on the front lines of our work on economic insecurity, domestic violence, and the intersection of domestic violence and guns. So I'm going to begin with economic insecurity. And here we're going to look at the spectrum of where women fall in our economy. When we talk about women, we really must remember that 80% of single parent households are led by women. And then you have to think about the types of jobs many women hold where they don't have the privilege of being able to work from home. The women who are domestic workers, who clean homes or care for children, women who clean hotels or offices, they've all lost their incomes. And then we hear about the women who worked in restaurants and relied on what's known as the family meal. That's when the restaurant staff eats together, and the women would use that as their one meal of the day so that they could save all of their earnings and their tips to feed their children. And now that is gone. And even beyond what this means financially, we know the struggles working parents are facing now having to homeschool their children. Well, what does that look like for a woman who may be an immigrant, where English isn't her first language? Women who may not have a college or even a high school degree. And then we look at the other end of the spectrum. In fact, The Atlantic wrote about this. For the women who are highly educated, who are able to work from home, and yet stereotypically in a two-parent household, they are still bearing the greater burden in childcare, perhaps aiding elderly parents, basically taking on that added emotional toll. And even being the ones who, in order to manage everything, they're the ones who are stepping back from their careers, which means it'll make it harder, if not impossible, for them to re-enter the workforce. And even if they can, they're never going to be able to make up those lost wages. Then, of course, we need to look at women-owned small businesses. These are vital to our economy. In the US, there are 12.3 million women-owned businesses that generate $1.8 trillion a year. In fact, 40% of US businesses are women-owned, and 64% of the new women-owned businesses were started last year by women of color. And we know that many, many, many of these did not get PPP loans, and that many will close if they haven't already. At the same time, we know that 52% of essential workers are women. So these are women who are risking their lives, their families' lives, who may, in order to protect their families, aren't unable to be with their families, and all of the single mothers who have essential jobs, but now under the pandemic have lost whatever childcare support they had. In fact, 1 in 3 jobs held by women are now deemed essential. But you have to understand that much of this essential work is underpaid, undervalued. Many don't have paid sick days, which think about what that means if they contract the virus. 9 out of 10 nurses, 99% of nursing home staff, the majority of pharmacists and pharmacy staff, 2/3 of grocery store and fast food checkout clerks are women. And 83% of the 5.8 million people working healthcare jobs that pay less than $30,000 a year are women. So that's just a snapshot of what's happening to women in the economy and the economic insecurity they're facing under the pandemic. And now I'm going to pivot into violence and abuse. And I want to begin by giving you the number of the National Domestic Violence Hotline. This is an important number to know, 1-800-977-7233, or you can also remember it as 1-800-977-SAFE. So there are different types of abuse. There's physical, sexual, verbal, digital, and we know there's an uptick of violence and abuse when there are added stressors. And the more stress, the more likely abuse moves to violence. You're hearing horrific stories of women whose abusers are threatening to throw them out of their home if they get sick, or who are forcing them to wash their hands so often they're actually in physical pain. The New York Times reported a story last week of a woman who quickly ran to the bodega to pick up an item, and when she returned, her boyfriend not only punched her and choked her, but picked up a trash can, hit her in the face with it, and then said, "That wasn't physical. If I'm ever physical, you won't wake up in the morning." And now under the pandemic, whatever moment those women may have had, whether she or her abuser were at work or taking children to school or running errands, moments they could use to seek help is not only difficult, it's impossible. Hotlines are reporting stories from women who say their abusers disconnected their cell phones, who hid in the room and spied while they tried to call for help or therapy or support. One woman reported that she went to the pharmacy and messaged home that there was a wait, and her abuser called her 8 times in 10 minutes. Domestic violence programs are reporting that women are saying they actually hope to contract the virus because they would rather be fighting for their lives in a hospital than at home with their abusers. And then there are women who aren't going to shelters because they're afraid that they or their children might contract the virus in the shelter, which leads to the economic impact on shelters and DV providers. Survivors are calling shelters asking for financial help for food and rent. Some shelters are trying to deliver meals. And shelters by nature are communal spaces, so they're now, in some cases, paying for women to quarantine in hotels or motels. They're also designed to be low tech in order to protect the survivors. Think about how easily an abuser can hack into an email or a Zoom call. So shelters are now trying to figure out how they can safely pivot to providing help. Some are moving to virtual services, and some believe it's still safer not to be online. And then when you think about financial abuse as a way of control, it's further complicated by the pandemic. Shelters serve as safe mail programs, so women can have their mail, their paychecks, anything they want hidden from their abusers sent to their shelters. But when they can't access those shelters for the mail, they don't have access to money. And now in many cases, those $1,200 plus $500 per child stimulus checks are being sent to the homes, which means the abusers are taking the money. Now let's add to the mix guns. Gun sales have been deemed essential. So they're gun grabs. People are hoarding guns. In fact, more guns were sold in March than any time since the background check system began in 1998. And what we do know is that when guns are present in homes where there's violence and abuse, a woman is 500 times more likely to be killed. But for abusers, guns aren't just used for homicides, they're used to terrorize. Imagine just what it means to have a gun in the home. The very presence is a threat. And one can only imagine the constant state of overwhelming fear these women are living. And this intersection of guns and domestic violence is one of the reasons JWI has been advocating for saner gun laws, most notably closing the boyfriend loophole, which currently allows abusive dating partners to own guns. And actually protecting the right of these abusers to own guns is the reason the Senate Republicans have held up the reauthorization of the Violence Against Women Act for more than a year now. You know, when all of this is over, we're going to want to forget. In fact, H.L. Mencken wrote in 1956 about the 1918 influenza pandemic that the epidemic is seldom mentioned, and most Americans have apparently forgotten about it. The human mind always tries to expunge the intolerable from memory, just as it tries to conceal it while current. So I ask you that you not forget what you're learning this morning, and that even when we're on the other side of this terrible time, you're someone who stands up for women and girls. Thank you.
Thank you, Meredith. That was wonderful. I'm filled with facts and detailed information, and I know there are going to be people who are going to have lots of questions about what you talked about. And so I'm urging people both during now and when Sheila is finished, if you have questions, to put them in the question queue. I'd like to say one other thing. Meredith's last comment was about not forgetting. And right before the call started, I told Sheila and Meredith, my mother-in-law, and my father-in-law were all born in the summer of 1918 during the pandemic. And it's interesting because as we've been going through this period right now, my husband and I have talked about it, and we never have had any conversations with our parents over years and years. They never said a word about the pandemic and how their mothers and fathers had dealt at that time. So it's interesting now to move and have this conversation with Sheila, who's going to talk a lot about abortion and pregnancy and the issues both that tie together from what Meredith just spoke about. So thanks, Sheila.
Great. Hi, everyone. Thank you, Susan. Thank you, Meredith. And thanks for having me here today. I'm going to dive right in by framing my remarks with a few things to keep in mind. And then I just really want to dive into specifically into the issue of abortion because of how critical it is right now. I'll share why, I'll share what's going on. And later, if you have questions on abortion access or being pregnant in this time, or we also focus on voting and immigration, I'm happy to answer those questions. But what I want to start with in repeating is that women currently make up the majority of the essential workers in this pandemic. And I believe Meredith used some examples like 9 out of 10 nurses. It's also 2 out of 3 grocery workers are women. And on top of women disproportionately being impacted, women of color in particular are disproportionately impacted. And so I just want to hold that the presenters today are all white and that COVID-19 really is having a greater impact on women of color who are more likely to be classified as essential workers working in low-wage jobs, and that these women already suffer health inequities and therefore face greater economic distress and poorer health outcomes. And so it also is worth saying that being able to maintain social distancing while working from home, I'm currently in my kitchen, I'm at my kitchen table, or telecommuting, enjoying virtual social events and webinars, these are all privileges, and we need to acknowledge that. I also want to name that the issues that we're discussing today, which are often referred to as women's issues, just as Susie said in the beginning, are not just women's issues. And it can actually be problematic that they're referred to that way. First, because it's a narrow definition of the people who are impacted by these issues, which also includes gender non-binary individuals, and specifically on the issue of abortion, it also impacts trans men. And second, women's issues impact everyone. And everyone, people of all gender identities, are needed to address these issues. Leaving it only up to women puts an unfair burden on the people who are already disproportionately impacted. So in addition to all the regulars who are here and all the great activists who we see often at JWI, at NCJW and in other organizations, Hadassah and others, we've been seeing more men step up as allies. And I just wanted to particularly thank the men who are on the call today. You have a really, really important role to play in speaking up and advocating on these issues. And for the remainder of the call, just know that when I use the term women, I'm also referencing gender non-binary individuals. So what is happening right now in the space of reproductive rights? So despite women's frontline roles in responding to COVID-19, the disproportionate role that they have with families, and despite women being twice as likely to lose their jobs in the current crisis, we are being left behind, left out, and in many cases actively attacked. So the relief packages that Meredith indicated, especially with the money that some are going to great places, some just aren't making their way to small women-owned businesses. You know, the relief packages overall did a lot of good and benefited many members of the marginalized community. And for those who could get the grants were really helpful. But it was also used as a weapon to attack women's reproductive rights. The Hyde Amendment passed as part of the coronavirus relief package. And so for those of you who don't know what Hyde is, it sadly gets passed every year as part of the federal budget, and it prevents federal funds from being spent on abortion services, which includes for Medicaid recipients, federal workers, and anybody else who gets health care through a federal program. So millions of Americans who rely on government health programs have been unjustly barred from accessing abortion for 44 years now. And here we are in the worst pandemic in anyone's memory, and we're being barred from what is essential health care for women, particularly low-income women. And so what does it mean for the Hyde Amendment passing as part of the coronavirus relief bill? It means that the $150 billion in relief funds that could be used for any response efforts related to the pandemic, any response efforts, have one exclusion, and it's funding abortion care. And as we know, abortion care is health care. People's pregnancies and circumstances for wanting to end pregnancies don't end in a pandemic. And so in addition to that legislation, anti-abortion legislators continue to use coronavirus as an excuse to prohibit access to abortions. So we've seen governors in the South and the Midwest attempt to classify abortion as non-essential, and in many states shutting down access for pregnant people seeking abortions. And we know that NCJW knows that abortion is safe, moral, legal, and an essential part of healthcare, which I'll say over and over and over again. Abortion is healthcare, abortion is essential. And you better believe that each time a state is making a decision to classify clinics as non-essential, the workers in clinics then have to call all of the patients and tell them that they can't come in. Many of the women who have already been to their first appointment, if their state has a 24-hour waiting period, can't come back to get the second one. Many people have traveled hours to get to these clinics, and then the back and forth that's happening right now with courts deciding whether it's essential or not essential is causing a lot of pain and trauma to the individuals, where the difference of a week is the difference of them being better off in their health as far as getting an abortion. And many of these women who are seeking abortions already have children, or they're already working, and they're trying to juggle what it looks like to be able to quickly and safely access this healthcare procedure. And so to tie this into what Meredith is talking about regarding economic freedom, I want to stress that there are many, many reasons a pregnant person might decide to have an abortion. And actually, most frequently, people seeking abortions are people who already have children and can't afford another child, or they simply don't want another child. Sometimes people are getting abortion because they've been raped, or they're in a violent situation with their partner and they don't want to be forced to have that child. Sometimes it's just because they're not ready to have a child. And whatever the reason, this is a personal decision, and no one should be forced to carry a fetus to term if they don't want to. This isn't The Handmaid's Tale. And so just in case you don't know, the statistics about women and people who can get pregnant who have abortions in this country are rather high. 1 in 4 women have an abortion. 25% of people who can get pregnant have an abortion, which means that everyone on this call knows someone and loves someone who has had an abortion. And even if you don't know who they are, in order to be a strong ally, it's really important to have conversations about reproductive freedom. It's really important to use the word abortion in conversations, as it helps to normalize the experience that 25% of the people who can become pregnant have been through. And so I just want to conclude with a story that was, I believe, in the New York Times, reported in the media from Texas. And then I'm happy to continue discussing the restrictions taking place on a state level, or talk about different issues on immigration, voting, et cetera, that might be of interest. But a college student studying to be a teacher in Texas lost her part-time waitressing job around the same time she found out she was pregnant. And she knew immediately that she wanted to get an abortion. And it was really, really hard for her to find a clinic that would see her, even before restrictions hit Texas. So eventually this person went to make an appointment, and due to social distancing, had to attend the appointment alone. She waited 2 hours in her car after signing in, while protesters were outside waving signs and screaming at her. And then once she was inside, she decided to have a medication abortion. But because Texas has a 24-hour waiting period, which is very common in a lot of states, just to prevent people from having an abortion, there's no science between waiting 24 hours once you sign up to have an abortion. She couldn't get the pills that day, and the next appointment wasn't available for 4 more days. And before she could return, the governor of Texas declared abortion as a non-essential procedure that could not be performed during the pandemic. So she already went through the emotional commitment to what she was going to do, only to find out that she couldn't then go get an abortion. So she frantically started calling abortions in other states. And in the middle of a pandemic, where you're supposed to stay at home, she ended up making an appointment 780 miles away and had to travel 12 hours for her to get this essential health care and sleep in her car. And she was lucky enough to afford this travel expense. So I just want to paint a picture of what it's been like for people who need this procedure, some for health reasons, some because for their mental well-being. And it's really important that we're paying attention. Guns are deemed essential in this moment, but abortions are not. And it really is a problem. We already fought for our right, for our constitutional right for reproductive freedom. We shouldn't have to fight again, but here we are. And so the only way we're going to be able to help the most vulnerable who are impacted by these policies is by knowing that this attack on our freedoms, that they're taking place under the guise of the coronavirus aid, and we have to speak out and support that abortion is essential health care. And so I know this call might seem a little sad. There's a lot of issues that are really depressing that we're talking about, but we have to open our eyes to what's happening here. And it's really important how many people got emails that they were excited about the relief aid that was coming from the coronavirus package without being informed that the Hyde Amendment was attached to it. These are things that are happening every day, and it's really, really important that we are acutely aware. I have several friends who are pregnant right now. It is a scary time. When they can't get certain medical appointments that they need, when they have to be scared about potentially going into hospitals on their own to deliver a baby. And it's a really scary time for any single person who's getting pregnant in this moment. We should be making it so that people getting pregnant don't have to be scared, that they have the medical procedures that they need, and they have the medical care they need for whatever decision they're going to make about their future. So Susie, I'm gonna turn it back to you.
Great. I'm having a little problem with my screen. Can you hear me?
I can hear you and not see you, but that's okay.
We'll work. Okay, that was fantastic. And the same thing to Meredith. Both of you have laid out a situation that all of us are so greatly concerned about. And one of the things that I think would be very helpful is if you could talk a little bit right now about, in particular, about the CARES Act. And people have been asking questions through this this morning about, okay, if you're a small business person, if you are having these difficulties, what should you be doing? And some people are also talking about equal pay in the issues that have been long-term for all of us. So if you could address that, it would be helpful.
Yeah, I can even talk about some of the things that previous stimulus packages didn't allow, and that the National Task Force to End Sexual and Domestic Violence, which both of our organizations are part of, are asking for. So the previous stimulus packages didn't, with corporations with more than 500 employees, are not being asked to provide paid sick time, but we're asking Congress to guarantee that all the workers are given a living wage, paid sick and safe days, paid family leave. The federal government could also pass legislation to make childcare more affordable, to make pre-K universal. Universal access to healthcare would benefit so many of these women, some of whom don't receive healthcare through their employers. So there are a lot of things that could be tied to getting access to this money in future packages.
That's great. Do you have, Sheila, one of the questions that I'm seeing, and actually for both of you, people are looking for things to do. What can they do right now? I mean, someone, a woman wrote in saying that she runs DINA, a small DV legal services organization in Philadelphia. And she said they're running programs that provide emergency services to survivors. But they're also doing a series of Facebook Live, yoga and meditation classes, and they want to highlight organizations doing emergency work right now. And could both of you talk a little bit about what types of organizations besides shelters and food banks would you recommend supporting, and both financially supporting, but obviously doing this through volunteer activities, which are so limited these days?
Yeah, I'm happy to start. I think there's so much people can do right now. I know it's overwhelming. And first and foremost, I want to say I make no assumptions about the people on this call and what you've experienced and who you might have lost and what the impact is going to be for you financially and for your family. And I think the best thing you can do, I said this on a call last week with NCJW, is take care of yourself, like make sure you're healthy, make sure you have the things that you need. And then like put your own life mask on first, and then we can talk about helping others. Being at home is a great time to do advocacy work. You can make phone calls, you could write emails, you could tweet at your senators, and a lot of people don't think things like that make an impact, but they really, really, really do. And so I know we'll put a slide on the screen at the end with some actual things you can do, and you'll get an email with follow-up, but right now is a great time to be actually communicating with your representatives around what you want to see in all of the coronavirus relief aid. And so including things like abortion to be essential, including things about making sure people have the paid sick time that they need, including a variety of things based off of the way you feel and the issues you care are really important. And a lot of the organizations make this super easy for you. We have a letter you can sign on to that lists out everything from economic freedom to immigration rights to abortion rights. I'm hearing an echo. I don't know if anyone else is. Yes? No? Okay. I'm going to keep going. They were trying to re-emphasize that it's really important to do this, so you heard it twice. And so we can get you a link to be able to sign your name on to things around that. But I would just say, first and foremost, you need to understand what's going on, and actually taking a moment to educate yourself and to be sharing about it and bringing it up in conversation with friends and on social media is really important, because we can't actually address these issues if they fall on the wayside and people aren't talking about them. So as simple as it might sound to say share a Facebook post or share one of the articles that we referenced today in your social media, it actually really matters to shift conversation and to make sure people are talking about it. And then we really do need to advocate right now. And I would just say women's organizations receive approximately 2% of the funding that's out there in the world. And there's inequities to begin with, that women think that they can only give to women's organizations. You don't see a lot of male funders of women's organizations. So donating to organizations like NCJW, JWI, Hadassah, other Jewish women's organizations really making an impact on the ground is really, really critical. So donate, advocate, and educate, I think, are the most important things you could do.
If I could just jump in also, and I would ask to, for all of you who are on the call, thank you, and to stay aware, both JWI and NCJW have advocacy emails that are sent out regularly, so you can stay on top of these issues. But I know what a lot of people are doing now that's very helpful is they're checking in with their neighbors, perhaps if they're elderly or sick, neighbors who are on the front line, just neighbors who need extra help to say, hey, I'm running to the supermarket, what do you need? I can just drop it off at your doorstep, or just checking in with people who might be more vulnerable, who might be alone, to just say, are you okay? This is especially important when we think about, again, those experiencing homes that aren't safe right now. And you don't know who those people could be. And there are a number of different cases. There are people who are already in abusive homes, where it could be escalating, or just that they're now trapped. There are also people who maybe didn't realize they were in abusive relationships yet, or maybe they were unhealthy and have now moved into abuse. And there are also some people who are now have decided to quarantine with dating partners who they weren't in living situations with before, and are now realizing those are not healthy situations. But understanding that they can't ask for help, something people are doing, and I would encourage you to do, is establish a code word. This is actually done in France. And just when you check in with a friend, if you know, if they say, I don't know, banana bread. Well, don't say banana bread because everyone's making banana bread. But if there's a code word that you can think of that they can safely say in front of their abuser that says, I need help. And then you can be the one to call for help, call the police, call 911, call a shelter, the shelters are still open. There are some shelters in California that had to close. There's some shelters that can't take new residents, but they are open. They're there to help. The hotlines are there. So that's another way that you can reach out and help people right now.
Great. One of the things that's sort of funny, as you talked a little bit about banana bread, which my daughter-in-law is becoming very good at, as well as I am. One of the things that also seems to be the case is that people are really having difficulty figuring out how to, basically deal with their day, their day-to-day. And someone asked me, I asked the question on that here, what are JWI and NCJW leaders hearing about the status at this time of Jewish women? I'm not sure if what that question is really aimed at, but to me, it's what, for the two of you who are leading organizations who obviously have to be like anybody else dealing with a small business, having to focus on things. How are you coping personally, and how are your staffs coping? Because I think that's something people may really wonder about.
Yeah, I'm happy to start. Well, I want to add something to the last question and then dive into this, which is, for those in a position of privilege where their income is coming in, where they're not worried about their safety, etc. A lot of the workers we're talking about are people who tend to clean apartments or take care of their children. And if you work or have relationships with anybody who maybe provide those services in your own home or in your families, and you're able to continue paying them throughout this time, it's definitely a way to make an impact. I have someone who comes to clean my apartment once a month, and I've continued to pay her in this moment, and called her on the phone, and she was in tears when she got like my Venmo payment. And so I think just like Meredith was talking about checking in on individuals, the way change is going to be made is at an advocacy level, so it impacts the system, but also on an individual level based off of the relationships we have. That said, how are we doing? Like, this is a really, really sad, hard time that's impacting the lives of the members of NCJW and our staff and our board in tremendous ways. We happen to have experienced a lot of loss, people who have passed away from coronavirus, or people who have passed away for other reasons in this time. The lack of being able to go to a funeral and doing Shiva in a normal way has been really, really challenging on those individuals. As you probably know, both JWI and NCJW are historic organizations in this country that have developed over time, and we both serve a lot of older women in this country, many of whom live on their own if their husbands have passed away or partners, and just because more women are living alone now than ever before in the history of this country. And so we've been working really hard to check in on them, and we hear that it's really difficult sometimes for people to get groceries and for people to get their medicine, and they don't know who to call. And we all have a little bit of a pride about us. It can be really difficult to ask for help. And so the more we could be doing to check in on people, the better. We're going to launch a way. If you want to help us call all of the people that we have phone numbers for 85 plus, there'll be a way for you to sign up to take a few phone numbers. Those check-ins are going to get more and more important as more time passes and people have less access to groceries, medicine, etc. And we want to make sure that just because there are women living by themselves, that they have the community to rely on. And so those are some of the things we're seeing. And just like every other nonprofit, we're impacted. Women's organizations are impacted more when it comes to finances and financial giving, because women are going to be impacted more. So if women make up the majority of donors and women are impacted the most, then women's organizations are going to hit the most. So again, if people have money, money is one of the best ways to make an impact in these moments, to organizations, to people. If you have time, advocacy, and really getting down to the relationships you have, thinking about your code word and what you could be doing to just check in on people and show up for them is going to be really, really helpful.
That's great.
You know, right now, JWI is going through our annual Mother's Day Flower Project campaign, and this has always been, for the past 18 years, an important project where people donate, and we use the proceeds to send flowers and financial literacy materials to women living in shelters across the country, domestic violence shelters across the country on Mother's Day. And in exchange, for every donation, we send a card to somebody you've designated. And I feel like it's resonating now more than ever, because people are seeing what it feels like to isolate out of fear, and what it must be like for these women and children living in the domestic violence shelters, and what it means when someone reaches out to you with the message of love, whether that's a flower or a card or a text or an email. And I thank whoever asked the question to check in on how Sheila and I are doing. We were both on a call last Friday that convened Jewish women CEOs, and it was convened by women who had recently served as CEOs and who are now retired, moving on to their next experience. And they asked everyone to say how they were, and everyone just said exhausted. It's a scary time. It's a challenging time to lead an organization, to be there for your staff, to be there for all the people you speak out on behalf of that try to help, especially some of the women who are talking about how their organizations really are direct service providers. The toll that it's taking anyone who is also juggling childcare and trying to help people. So it's a hard time, but as Sheila said, support us. Like, make sure that we're here the day after the virus, as we've gotten control of the virus.
That's terrific. Sorry for the whoops. Trying to fix this. I'm having difficulty. Let's see. I've moved my phone, so because I had lost you all.
It's not a webinar unless there's some tech glitch along the way. We're all used to it.
I feel like I'm part of a Saturday Night Live.
Although, you know what's wonderful about this, also when we try to fix it.
Okay, I'm back.
Positive things happening. So the way we have all used this time to build community, the way we've, you know, those of us who are, as Sheila said, who are privileged enough to be able to be home, who have access to technology, who have working internet, the way we're reaching out and there was something beautiful that our Young Women's Leadership Network did around Passover. They had a virtual Seder that the young women wrote the Haggadah and opened it up to everyone. And there wasn't a dry eye on any of the screens by the end of it. And there was actually an older man who had called in, and he typed in and he said, "I miss my friends." And he said, "I wouldn't have had a Seder without this." And that's what I focus on, are these moments that we wouldn't have thought to create in other times that are so important. And that gives me hope, and that keeps me going.
Yeah, there's definitely a lot. I mean, I think we hit on a lot of really difficult topics. I do want to name that, there are so many elections coming up, and we saw an example in Wisconsin that was not great, of asking people to go out and vote, which resulted in several people getting coronavirus because it was unsafe. And one of the big things that it doesn't even really feel super political, that I think is important for everybody to be pushing right now and thinking about, especially DC, like our election's supposed to be coming up in June, is advocating for at-home voting and more access to voting from home. And so I just want to make a push that if you care about any of the issues that we talked about today, then pushing through and calling your senators about at-home voting, and just to make sure, registering to vote is complicated. I'm not one of those people that assumes everyone around me is registered. It's hard based on where you live, or if you filled out the form, or if you remember to mail it, if you've got a stamp, whatever it is. So make sure you're registered to vote, and make sure you've requested an absentee ballot if you're able, and then have those conversations with your friends and family also. We have to figure out a way for all of us to be able to participate in democracy and also stay safe. And there's a lot for you to consider voting on at a local level. I know everybody in an election year, presidential year, people think about that, but it's really important that we think about who we're electing at a state level, at a local level. And for you, we're C3, so we won't tell you who to vote for. That's for you to decide. But I think you're at home. Hopefully you have a little bit more time to read on some of these things and the people. And I would just really encourage you to make sure that you're all set up to vote in a safe way. And just because it was something that I said I might talk about, I'm just going to add in, if we didn't have enough things to be worried about. 2 cases I just want to flag for you that are in the Supreme Court right now that we were already watching before the pandemic, that actually seem even more important post-pandemic or current pandemic, is the Supreme Court's actually expecting to issue decisions that will determine the essential rights of women and pregnant people to make their own healthcare choices. So 2 cases. The first is to have a decision next month on June Medical Services versus Russo, which is the first abortion rights case to be heard under the current makeup of the court. And in case you don't know about it, in sum, the case challenges a Louisiana law that would shut down every abortion clinic in the state except for one by forcing clinics to adhere to rules that have nothing to do with the safety of the procedure, right? So part of it is dictating how wide the hallways have to be and how close in proximity to hospitals they have to be, when that has absolutely nothing to do with people having healthy abortions. And now the other one, which is happening next week, the Supreme Court is actually hearing arguments in the case Trump versus Pennsylvania on whether the Trump administration regulation around employers who can invoke their religious or moral beliefs to withhold contraception coverage from employees and students. So to be clear, both cases together means that there's an attempt to prevent people from having birth control and an attempt to prevent people from having abortions happening together. And it's just a reminder that this is an all-out attack on women making decisions for women. And it's really, we have to pay attention, especially in this case, Trump versus Pennsylvania. There are a lot of Jewish organizations that would be happy not to have their employers on birth control. And it really should be the decision, our position, of every individual to make those decisions for themselves. So I would encourage you to pay attention to the news on those cases and to know that there'll be probably virtual rallies before these cases and afterwards, depending how they go, and opportunities to make your voice heard around what that means, particularly for those of you who work in religious organizations. The Trump versus Pennsylvania case is relevant to you and really important for you to say what your position is and to make sure your employer is offering people the health care that they need. I don't know, Meredith, if you've been following. Yeah, if you think.
Yeah, I mean, Sheila, I'm so glad you mentioned voting and also what's happening in the Supreme Court. I mean, when you think about it, everything we talked about today, what can you do to change all of those things? It's who you vote for. From how this pandemic has been handled in the US to all of these rights and legislation that are being challenged or things that could help. And we can't wait until September or October to make sure that we have safe ways to vote. That needs to be done now. That needed to be done 6 months ago. And if you're looking for other organizations really on the ground doing great work around voting, check out When We All Vote and also Fair Fight, and make sure that everyone who can vote, votes.
Yeah, and we're gonna do, if anybody has never done like well, clearly digital lobbying is new for everybody, but if you've never lobbied before, we're gonna host an event on May 20th, a digital lobby day that's actually all about at-home voting. So we'll teach you what to do and say, we'll teach you what emails to write, we'll teach you what tweets to share. So you can join us. It's like a good primer on how to do advocacy as a whole while you're staying from home, but the issue we're gonna dive into is access to voting in safe ways, which we think is a really broad, wide issue. And so we'll send you the links and hope that you'll join us, and maybe JWI will have you work with us on it. We'll have to connect after and talk about it. But I agree. Right now, I'd say for people who are helpers, which I imagine most people who have joined this call are, it can be daunting to figure out ways to show up. And I want to encourage you to be kind to yourself and to know that actions that in the past might not have been seen as something that's enough. You know, the world has changed and what we can do is different. And sharing things on social media, participating in webinars, calling your senators, those are all victories that should be celebrated and should be encouraged actually for folks to be doing more of. And so to be kind to yourself, like find something to do. Don't do nothing, but it is different. We used to kind of make fun of couch activism, slacktivism, and now like we're all getting together and doing activism from our couch. So know that everything has changed, the landscape has changed, and the way we do this work is different. And so let's just like lean into that together and find ways to continue to make an impact.
That is a great way to end this.
Oh, hi.
Hi, that's a great way to end. One of the things that is so critically important is that everyone understand that it's a new, we're still in the during. There was a before, there's going to be an after, and right now we're in the during. And in that during, we can all do what we feel is most important, whether it is making sure you try to have a Mother's Day that is something that's meaningful to you, whether it's making sure that you, if you are able, can help your neighbor in some way or another, but it's also making sure that the after is going to be better. I mean, that the after is going to take all of the craziness of what we've been going through, but also making sure that we learned from this experience and that we make sure that experiences like this are one in a lifetime. What we need to do as we're ending this is really to recognize what Meredith and Sheila just talked about. You can be involved. You can be that lobbyist. You can say what you're thinking and how you're feeling and what makes a difference to you. And you can stand up for the people who don't have other people to stand up. JCPA does that. NCJW does that. JWI does that. This is the first time that Meredith and Sheila have had this chance to be and do a seminar together, a webinar together, and we're going to have it online. We're going to put online other ideas right now in an email to all of you about what you can do. We can all do something. There's no question about it. Whether it's writing that letter about the issue that hit you today that is the most important, whether it's sending that email, whether it's clicking, whether it's doing a Facebook post, whether it's doing a tweet, whatever you can do, do it, because these issues are that important, and together we can make a difference. So I want to thank you all. We had over 400 people online today with us, and we really appreciate this opportunity to spend this morning with you. Thank you.
Thank you.
Thank you. Be safe.